When your patient will not take pills, you can sometimes dissolve them in water, but a whole pill will take ages to dissolve, and crushing pills is hard and messy. If only there was a physics hack to dissolve pills without crushing them. Oh wait, there is! Take a syringe and remove the plunger. Drop the pill into the syringe, reinsert the plunger, and press it all the way down. Drop a little water, but don't fill the syringe more than halfway. Remove most of the air, then firmly plug the syringe tip with the thumb of your dominant hand or a stopper to create a seal, and hold the syringe securely with your other fingers. Forcefully pull the plunger back to create negative pressure inside the syringe. This stresses the pill, causing microfractures that allow water to penetrate. It also initiates a phenomenon called cavitation, where teensy-weensy gas bubbles form in the water. When you let go of the plunger and let it snap back down, the sudden pressure increase causes these microbubbles to violently collapse, generating shock waves and high-speed microjets that break the pill apart along the fracture lines. You can repeat this as many times as necessary, though 1 to 2 shocks are typically enough to fully dissolve the pill. Remember to never ever inject a pill that was intended to be taken by mouth, and not all pills are allowed to be dissolved, so triple check before doing so. Some medications, like certain antibiotics, come as powders that cannot be injected directly, so you must first reconstitute them by adding the right amount of sterile water. Remove the caps from both vials and clean the rubber stoppers with an alcohol swab, then let them air dry completely. To draw up the sterile liquid, attach a blunt needle to the syringe and inject the same volume of air into the diluent vial as the amount of diluent you plan to draw up. You do this because these brand new vials are airtight, so it can be hard to draw up medication without using excessive finger strength to fight the negative pressure that forms in the vial. By injecting the air into the airspace of the vial and inverting the syringe, it will fill itself to the right level, without you needing to suffer finger blisters from forcefully pulling on the plunger. Inject the sterile liquid into the powder vial. You may feel some pressure pushback, which is completely normal. Allow any excess air to vent back into the syringe before withdrawing it. Do not shake the vial, as this can create dangerous bubbles. Mix the medication thoroughly by gently rolling the vial between your palms until the powder is fully dissolved. Inject air equal to the volume of medication you plan to draw up into the reconstituted vial. Then invert the vial and let the syringe fill itself up. Finally, attach a new sharp needle for injection. To give your cat a pill without getting killed, first position yourself behind the cat so they cannot back away. With your non-dominant hand, securely hold the cheekbones just behind the whiskers and the back of the skull. Then slowly tilt the head backwards, using your dominant index finger to help do so. But please be careful not to overextend the neck. With your dominant hand holding the pill between thumb and index finger, extend your middle finger and open the mouth by gently applying pressure on the lower incisor teeth. These teensy-weensy front teeth will not harm you, but do be careful to avoid the larger canines. When the mouth is open, swiftly reach inside and place the pill on the back of the tongue. It is really important that the pill goes deep enough into the mouth that it cannot be pushed back out with the tongue. Then gently close the mouth and try to hold the jaw closed for a few seconds, stroking the throat in a downward motion to encourage swallowing. At this point, your cat will definitely wish to run off and hide, and you should definitely allow them to do this. Just follow them for a few minutes to make sure the pill isn't spat out, or you'll have to do this all over again. Watch for lip licking, which usually indicates that the pill has successfully been swallowed. To further increase your chances of not getting killed, never try doing this with an aggressive cat.